Hello, class. How are you? Today we are with our guest speaker, John Frederico, who is a physical therapist. Hello, John.
Hi, how you doing?
And today we're going to go through what his journey was like, a little bit about his career, and have a couple of questions asked by you students. So, John, if you could get started, can you please share or introduce yourself along with your profession, current employment, your training, and any identities you may have?
I'm John Frederico. I'm a physical therapist. I work at Loma Linda University Medical Center. I went to PT school at Loma Linda University. Prior to PT school, I had done a physical therapist assistant program as well, also at Loma Linda University. I have a bachelor's in business undergrad at Pacific Union College. And yeah, here we are. I am a Seventh Adventist and a third generation college student, or college grad, second generation grad school grad. So
Awesome.
That's a little bit about me.
All right. Great. Thanks, John. It's great to see that in your family, there have been a lot of folks who have gone through the educational path before you. And then also, I can tell you love Loma Linda.
Well, they love to take my money.
There's that as well. All right. So let's get started with your own individual journey. So what do you do as a physical therapist, and why? What drew you to this career?
Well, what drew me to the career, first of all, was kind of an experience I had in high school where I was able to be involved in a first responder situation, and thought that maybe being a first responder, like an EMT or something, would be what I'd want to do. And through that, decided that I wanted to help people, and I enjoyed sports and athletics in high school. Go San Gabriel Academy. We were involved in sports and athletics, and I actually had the opportunity to go to physical therapy, and kind of discovered about it and thought about it and said, maybe I'd like to be able to work with, young athletes or high school athletes, or even, collegiate or pro level athletes, which, is always the dream. But after I got into PTA school, I went through that program and decided and kind of discovered that I enjoyed both the outpatient orthopedic side of things as well as the inpatient acute side of things. And currently I'm working at Loma Linda University Medical Center as a physical therapist. I did go back to school after finishing the PTA program and getting that license and degree for my doctorate. And so working in an inpatient setting now at the University Medical Center allows me to work with patients who are hospitalized, who need physical therapy to help them following traumas, surgeries, major, minor surgeries, illnesses. And so what I do on a daily basis is help patients hopefully return to their prior level of function, which most typically consists of being able to get in and out of bed, stand and walk, and do some stairs and work on some balance things. And so that's kind of what I do on a daily basis. I didn't always do inpatient acute, although I've kind of always had a foot in that door. I did work outpatient ortho as well, orthopedic being post-op knee replacements, shoulder repairs, shoulder strains, low back sprains and strains, ankles, hips, knees, all of those kind of peripheral joints as well. So that's still near and dear to my heart, but right now I'm not practicing in that area.
Yeah, that's awesome. So actually, John and I went to high school together and played volleyball, not at the same team, but the guys volleyball team and the girls volleyball team would do some things together. And I remember in high school, John was all about like, okay, well, maybe you should try this stretch or that stretch. And now he's in a career where he's able to use those skills with movement to help folks recover. Awesome. So what has your career path been thus far? I know you kind of touched on you going through your various educational levels, what about what kind of jobs did you have to get you to this point? And was everything always PT, or did you have like some random jobs that you felt like weren't quite clinical, or, you know?
Sure. So going through college, I did have a few jobs. I worked in the cafeteria. I worked custodial for the church, actually, on the college campus that I went to. I worked at the front desk for the dorm that I was in. I worked at the pool as a lifeguard, and actually working as a lifeguard was probably the job that I did most on summers when I was home. And then even a little bit when I first started in PTA school. During PTA school, it was really kind of challenging for me at least, to be able to hold and keep a job, especially with the jobs that I'd had leading up to that point. So when I was in school, I focused mainly on school. And then for us in the programs, you go through and you have rotations. And when you do your rotations, they send you out to different clinical sites and experiences, inpatient acute experiences, outpatient orthopedic experiences, rehab experiences at rehab hospitals. And depending on what you choose, there's also options for home health experiences, as well as skilled nursing facility experiences. I did finish the PTA program and started working at an inpatient hospital, Redlands Community Hospital. And that was through having done one of my clinical rotations there. Another job that I did and held for a little while, about 6 months in between programs, was also at a skilled nursing facility out in Palm Desert. And I worked there for a little while, and then was able to keep the inpatient acute job kind of on weekends when I went through PT school. It was a way for me to help keep my skills fresh and to be able to continue to practice and maybe, earn a little bit of spending money on the side. And once I graduated from PT school, I was interested in doing orthopedics. And again, like I said earlier, I was kind of super stoked on being able to work with athletes and outpatient environment, and actually ended up at the outpatient orthopedic clinic while continuing to work at the hospital on the side. Eventually, I ended up going full-time to outpatient orthopedics. I did a residency program for orthopedic clinical specialty. And after I finished that program and continued to work in the orthopedics area for a little while, I decided that I wanted to get back to acute care and the flexibility that it offers in comparison with schedule. And the larger hospitals have more staff, so there's a lot more flexibility with who you see and the variety and volume of patients that you see. So that's kind of how I got to where I am now.
That's a lot of experience. And I think it's amazing how you were able to go from, using these different experiences that you had during college to help prepare you to get into a PTA program. And that's what really helped you get into the field. And then from there, how you've kind of explored different areas in physical therapy. I think it's interesting too that you mentioned how flexible acute care would be, because I would think that from the outside you think, oh, like outpatient, that's a lot easier, right? It's not as hectic or whatever, but it does make sense from what you were saying that there are more PTs, so it's going to be more scheduling is going to be easier having more people around.
Right. One of the things with the inpatient versus the outpatient schedule experience, outpatient scheduling, you have a patient who makes an appointment for 8 a.m. And you're booked then from 8 a.m. until 4 or 5 p.m. when you get off work. With the inpatient experience and the scheduling, you're allowed a little bit more flexibility in when you start. So rather than you're there from 8 to 5 and you have a patient scheduled every hour, you're there from, let's say you want to get there at 6:30, you have kids you have to drop off at school by 6 a.m. for band practice or whatever some of my coworkers have going on with their families. They can drop their kids off at school, start at 6:30, and then they're done by 3. They're out, they're able to get home to pick up their kids from school without having to worry about spending a whole lot on after school programs and daycare or childcare. And so with that, it's also allowed me to, as Aaron mentioned, volleyball has been something that has been a passion of mine. I have actually been able to coach volleyball while still being able to hold and work a full-time schedule. And the flexibility, I can start as early as, like I said, 6:30, and I'm done by 3. Practices, 5 to 6 or 5 to 7, with games starting as early as 3:30 sometimes. So it's kind of easier that way. If I was working an outpatient job, I'd have to take time off every day to be able to do that. So it really allows me to explore my passions and continue to do the things that I enjoy.
That's awesome. Yeah. And I think that's one of the things that we want students in this class to start thinking about, is like envisioning them as professionals, right? What does that mean to be a professional? Like, what are the realities of having a job? And it's great to hear that in PT you've had that flexibility to try different things and still maintain like your outside passions and hobbies. So on that note, kind of switching to more about your career, what is the best part of being a physical therapist?
The best part of being a physical therapist is making a difference daily in someone's life. And most often that's the patient's life. Occasionally it'll be your own life or a coworker's life, but most often it's the patient's lives, being able to see progress, to be able to see pain go from prominent and present to absent and non-limiting. When I was working in the outpatient setting, having high school kids come in who had, torn an ACL from playing soccer, rehabbing them to be able to get them back to being able to, not maybe getting back within the same season, but being able to get back and be able to be a player on the team the next year. With some of the elderly patients with a total knee replacement, going from using a walker and limping to using a cane, and then to being able to walk without a limp and be able to resume hiking activities or gardening activities. And that's just the outpatient setting. On a day-to-day basis, in the inpatient setting, I see a patient go from day one post-op to walking around the unit, walking up and down the stairs independently with family, struggling to get out of bed on that first day. And by day 4 or 5 or 6, 7, being able to sit up independently without any physical assistance, and to be able to ambulate or walk around the unit. And just, these people are people that come in without any deficits prior to surgery, and surgery really takes them back, knocks them kind of back a little bit, and they're able to build back from that and do the things that they want to be able to do to get home, to be with their families. So.
Side question. I noticed that you do mention a lot about working with athletes. One of the other careers that we're covering this week is athletic training. Have you ever kind of considered doing athletic training rather than physical therapy?
One of the things that I did look at when I was in undergrad and considering athletic training versus physical therapy is kind of talk to an athletic trainer and talk to a physical therapist. And then when I got to PT school, after I kind of made that decision, was one of our PT professors was actually an athletic trainer and a physical therapist. And just the differences in what they do on a day-to-day basis, as well as the educational background and the theory and practical implications of what's behind your education. I felt like physical therapy was going to push me personally a little bit more, and that it was going to be the best fit for me. Obviously, I didn't become an athletic trainer, and I know several of my friends who have become athletic trainers and they love it. But I couldn't tell you exactly what an athletic trainer does on a day-to-day basis. But I do know a little bit about the differences in education level and kind of what obviously we are required to know versus what an athletic trainer doesn't necessarily have from a physical therapy standpoint.
Got it. Cool. Thank you. So And maybe part of this is tied to having to go through more education. But what is the most challenging part of being a physical therapist?
Personally, the most challenging part of being a physical therapist is dealing with patients that can be a little bit undermotivated or challenging when they have a challenging personality, when they are struggling to see the benefits that we can provide, despite us doing our best efforts to educate and inform them on what we're trying to get accomplished and trying to help them with. So I'd say that's probably the most challenging is, and it doesn't happen very often, but every once in a while there's somebody who just doesn't see the benefit and doesn't want the help. And that can be personally frustrating. But we do our best to educate. And like I said, there's different personalities and even within PT. And so I might not be the right person for somebody. Somebody else maybe is going to be able to reach them a little better than I will. And vice versa. It's it's all different.
Yeah, it is still a human being trying to connect with another human being, right? And sometimes personalities mesh better than others. Kind of related to that, have you seen how culture and language have played a role in what you do?
Yeah. So with culture and language, obviously, there, and I practice in the Inland Empire. We have a strong, predominant Spanish-speaking population. And, I took Spanish in high school. Aaron can attest to that. We sat in class together. But the classes that I took in high school and didn't really practice much throughout college kind of left me feeling like I was at a disadvantage in the workforce. But I did marry my wife. She speaks Spanish fluently, so she helps me out. There's always Spanish language interpreters on campus to be able to use, and I've actually been able to get through some of the Spanish evals. I'm able to be understood, and I do my best to understand. And when there's a question, I can always grab somebody who does speak the language more fluently than myself. Cultural barriers, yes. There are some cultural and religious differences where in the outpatient setting, I remember I had I believe a Muslim female patient, and it was her specific request not to have a male therapist. So in those scenarios or environments, it's always patient dependent. We do our best to accommodate those when possible. I think when I was working in that outpatient environment setting with that Muslim patient, we did not have a female therapist option. So I had to do my best to work through that and have her do as much as I could without actually putting my hands on her. And then I have had other Muslim patients who, you're a medical provider and you're providing the care that I need. So that's okay. Go ahead. You can assess my neck for, my soreness or my pain. In the inpatient environment, a little different. Modesty is key with a lot of cultures, and we always do our best to help preserve and maintain that modesty as best as possible. Appropriate draping, gowns, shawls, covers, making sure that the patient is comfortable. Those are just some of the few cultural differences that I encounter on a week-to-week basis. Or other than that, I'm sure there's others that I'm forgetting, but those are the big ones.
Definitely something that you have to encounter frequently, is what it seems like. Yeah. So what advice would you give to an undergrad who is interested in becoming a physical therapist?
Reach out to a local physical therapy school that you're interested in attending. Talk to one of their admission counselors or admission representatives. I know at Loma Linda, where I attended school, there was a recruiter, I would guess, that would come to the different schools and actually came to where I attended undergrad. And I got in contact with them, they directed me to contact and talk to the director of the department. And so I called him, set an appointment. I remember driving out and sitting down and having a face-to-face and saying, these are the grades that I have. These are the classes that I've taken. Obviously looking at the programs first and seeing what they require and making sure that you're kind of on that track already, talking to your undergraduate guidance counselor and making sure, because they should know also what classes you would need to get into programs. But then talking to them, the schools, and seeing what exactly they require, what GPAs are typically accepted and, accepted into the program would be an important step. Not only that, but talking to a physical therapist, shadowing a physical therapist is really important. Most schools require something like 80 to 100 hours of observation in various practice settings, whether it be outpatient or inpatient. They require you to do that. I believe when I went to school, I had to do 80 hours in total. 20 hours had to be inpatient, and the other 60 could be either inpatient or outpatient. Again, most people, when they're deciding they want to do physical therapy, they have that outpatient bias or bent because that's what they think they want to do. And so the schools try to help kind of open your eyes to, yes, outpatient is a big part of what we do, but there's also other settings, and inpatient is definitely one of them. As far as the schools go, once you're in the programs, they typically require an outpatient rotation and an inpatient rotation. So you have two definite rotations you have to do. So making sure you know what you're getting into, seeing how somebody else practices and what that is like for them, to make sure that it's something that you think you want to get through and do. So.
On that note, for some of our students who maybe haven't met a PT before, how would they go about talking to one or trying to shadow one?
So in order to shadow a physical therapist, you need to find a physical therapy clinic or hospital that will allow you to do so. So you can go online, find your local physical therapy office, pick up the phone and call them, and you'll usually get the front office and say, hi, I'm, so-and-so, and I'd like to see if I can observe or shadow or follow, a physical therapist. For your inpatient observation hours, you're most likely going to have to be in contact with a volunteer office for the hospital, and then kind of figure out from there where to be able to shadow. Inpatient is typically a little bit harder to get into follow somebody. So if the deadline's coming for you, make sure that you don't wait on that. That's something that you want to get taken care of probably first. As far as outpatient goes, like I said, any clinic that you can contact or call, and there are quite a few. So if one doesn't work, go down the list and see if you can find another one. Ideally, in the kind of practice setting you want to be involved in. There are a lot more clinics nowadays even than when I was going back through, but some are traditional orthopedic clinics that'll work mostly with knees, hips, shoulders, joint replacements, and that sort of thing. There's also some of the more movement science-based approach clinics where they work with the more athletic population as well. So if that's what you want to follow, find that clinic and call them.
Awesome. Yeah, I think that's great advice, because sometimes students don't know, like, okay, how am I supposed to get in contact with a professional? That's actually one of their assignments, to contact a professional, do an informational interview, kind of like what this is. But they might not know, like, how do I get started with that? And so actually, like, picking up the phone and cold calling, that's the way to get started. Awesome.
Yep.
So I'm going to switch over to our forum to see what folks asked. So Jonathan has a question for John. I saw that your minor is a different major. What made you change your mind from the pathway that you were following? In other words, what made you love the most of having to help others by returning them to their prior level of function. So I think he's referring to the fact that you had a different undergrad, right? You did
Right.
in kinesiology. What kind of made that switch for you? Because we actually do have some folks in the class that are not health majors.
So when I had the experience in college, in high school, being involved as a first responder, one of the things that I decided once I finally decided on physical therapy, and I was, as I mentioned, thinking about the outpatient orthopedic side of things and working with athletes and all that, is I knew that I had to be in school for at least 3 years. At the time, most schools were a 3-year and transfer. Now they're you have to have a bachelor's degree first. But at the time that I was applying, it was 3 years before you could transfer. And I said, if I have to be somewhere for 3 years, what's an extra year to get a degree and have something to be able to use either as a business major, which I was, and I got a business degree, a bachelor's, like I said earlier. Getting that bachelor's degree in business gave me the opportunity to either work in the business field if PT didn't work out, or and I still like the possibility of being able to open my own clinic someday. So having a business background gave me kind of a direction, a purpose, and get something while I'm in 4 years of undergrad that maybe I can use and kind of help work towards my goals in the future, which would still be nice to be an outpatient clinician and own a clinic. Not crossing that off my list just yet, but definitely I understand, a lot of people say, well, you didn't do that kinesiology major, or you're not an allied health major, pre-professional, program. But that was my answer. That was my reason. I wanted to have something that I could fall back on, or something that I could build on with a PT degree as well. So,
yeah. So definitely you do not have to major in kines, evidence here, to be a physical therapist. You just have to make sure that you complete all the prerequisites that I was talking about earlier.
Yes, correct.
Cool. All right. Question from Karina. Well, she was saying you have a very impressive background and congrats on all your accomplishments. My question is, how did you know you wanted to become a physical therapist? I think you did allude to this, but she does end it with, go Dodgers. So.
Go Dodgers. Maybe you can read it, maybe you can't. This is a Dodger shirt. I am a Dodger fan. I think that's probably on my bio as well. Yeah. But I decided that something where I could help people be involved and possibly be involved around athletics was something that would kind of be what I wanted to do, and something that I could do on a day-to-day basis. Being involved in that first responder incident, I was able to see that I was able to make a difference in someone's life, and the personal satisfaction and reward that brought me was something that I wanted to continue to be able to have on a day-to-day basis if possible. So that's kind of why I did that. So
awesome. Well, those are all the questions that I have. Do you want to end with any other words for the students?
Whatever you guys decide you want to do, give it your 110% effort. Don't forget to study hard, but also don't forget to take time for yourself. Making sure that you have time to spend with friends, time to focus on your health and go to the gym, go for a run, be active. Again, if you do decide on physical therapy, being an example, a model to your patients is oftentimes the best medicine that they can receive. Seeing someone do and practice and be what they preach. So I think that probably would be a good place to start with that.
Awesome. All right. Well, thank you, Dr. John Frederico. And students do have access to your email if they have any further questions to ask. So,
awesome.
Thank you.
All right, guys. Thanks for having me.